A Longview orthopedic surgeon gets FDA approval for a unique technique to treat low back pain and more specifically, sacroiliac joint dysfunction. It's also minimally invasive and was first performed at Longview Regional Medical Center. Dr. Babajide Ogunsinde, a Harvard-trained orthopedic spine surgeon, joins us now. Thanks so much for being with us.
Thanks for having me.
So, Dr. Ogunsinde, this is being called a cutting-edge treatment for East Texas patients. Can you talk a little bit about that?
Yes, absolutely. Again, thanks for having me. So this procedure is called a posterior medial to lateral trajectory approach for sacroiliac joint fusion purposes. There are many other techniques that have been published in the spine literature about sacroiliac fusion, and those involve multiple incisions, longer surgeries. They're more painful. Patients have weight-bearing restrictions for about a month to 6 weeks, and it involves a longer procedure and more blood loss. So this procedure that we started at Longview Regional was inspired by looking for a way to reduce those factors: the pain, the bleeding, the multiple incisions. So we devised the technique where we make a single incision just below the like the L5 S1 level, which is at the waistline. We make it in the midline, and then we aim from that incision. We can address both SI fusions with a 1.5 to 2 centimeter incision, and by doing this, we can put 2 to 3 implants across the SI joint, which is the sacroiliac joint, without having to switch sides. Minimal blood loss. There's no restrictions in terms of weight-bearing status. And when we devise this technique, you have to go through a process. That process involves getting this approved with the FDA. And once we had that done, we were happy to present this to the public.
So I think most of us probably don't know about our sacroiliac joint until we start having a problem, and then you start hearing about that SI joint dysfunction a lot. And maybe as we get older, or those who are like really active. Can you tell me a little bit about who this procedure is for?
Yes. So I'll tell you about sacroiliac joint dysfunction. So it's we have known risk factors for sacroiliac joint dysfunction. A few of them are women, patients with high BMI, over 35, so slightly overweight. We have patients that have had multiple children, and also post-traumatic. So we have patients that have had trauma to the pelvis, trauma to the SI joint, and by doing that, it stimulates arthritis of the SI joint. And those patients present with back pain, and they have a normal MRI of their back. So typically about 30% of patients that have back pain have SI joint pain. So 10, 15 years ago, when we didn't know anything about SI joint dysfunction, we just thought these patients were not being honest, or we felt like they had some psychosomatic problems. But now that we know that SI joint is a problem, especially for low back pain, when you see a patient with a normal MRI and physical exam that correlates with SI joint dysfunction, we definitely go after that. And we've had so much success with identifying this and treating this either non-surgically and surgically.
So talk a little bit about how long the procedure takes if someone in East Texas comes to you and they're going to have this procedure.
Good question. So the old technique, when I say old, we're still using the technique. We have the lateral to medial technique. We have the posterior oblique lateral technique, and this is a posterior medial to lateral technique. A typical sacroiliac fusion takes about 25 minutes per side. So on average, if you do both sides, it will take you about an hour to do both sides. This surgery takes about 25 minutes for both sides. It's shorter, it's minimally invasive, there is no trauma to the soft tissue, there is no weight-bearing restrictions. We've done these surgeries on people as young as 24 from trauma. We've done this as old as 90 in older people that have degenerative changes of the sacroiliac joint. They have good outcomes. We typically say at 6 weeks, most people have about 50% reduction in pain. At 3 months, they have close to 90% reduction in pain. And these are pain that back in the day, there was no solution to it. So patients would have to live with this pain 10, 15 years ago and take pain medication. We've been successful to get patients off pain medication with the SI fusion and also to reduce their dose of pain medication with this procedure.
So is this a day surgery or do you have to spend the night in the hospital?
Okay, good question. So this is a day surgery. Again, I always joke with the patients. I say, this surgery you can have done and stop by a restaurant to have lunch on your way home because your length of anesthesia is only about 20, 25 minutes for the surgery. You spend about 30 minutes in recovery and then they discharge you home. Typically, I would discharge patients home on oral pain medication. There's no restrictions in terms of ADLs. Shower, they can drive in about 1 or 2 days if they're off the pain medication. So the restrictions, the pain is less. We don't have any restrictions for this surgery. We've had patients within 2, 3 days sending us emails about how great they feel after the surgery.
So what does that FDA process look like to get approval for something like this?
So it's a rigorous process. It's the first that I know of in East Texas, or at least here in Longview, Texas, of an FDA-approved technique for spine procedure. And basically, what you have to do is submit a 510K. A 510K is a approval process. You send it into the FDA, and they check it for safety and effectiveness, and make sure it doesn't harm the patient. And then they also test it for that does it reduce or does it do the function it's supposed to do, which is stabilize the sacroiliac joint and fix the sacroiliac joint dysfunction. So we turned in the FDA approval. It takes a couple of months, and we got an approval from the FDA July of this year that this was a very safe, very effective technique. And there are some studies out there actually by a company called SI Bone in California that shows that this technique actually has more stability than the other techniques like the posterior oblique lateral.
And I read that the 3D printer is used in this somehow. Can you explain that?
Yes. So a lot of our screws are titanium screws, and they are machine screws. So now, due to technology advancement, we have this 3D printer, which I've actually observed in real life, and it's pretty impressive. It prints the screw out of thin air. So it's a printer that like pretty much prints out the titanium as you're looking at it out of thin air. And the screws are stronger. These screws that we're using are porous. When I say porous, that means they have holes in it. The reason why you have holes in it is you want what we call an ingrowth fusion, which is the bones grow into the holes. And you also have what we call a rough coat. The rough coat of the screw allows the fusion to be on growth, which is there's bony fusion on top of the screw, and there's bony fusion inside the screw. So this, as the bone grows into the screws, it stabilizes the sacroiliac joint, and by doing that, it reduces the pain. We've had patients come from out of town just for this procedure. I had a lady come from Houston after finding out how we do this technique, and we did her SI fusion, and she sent us emails on how well she's doing.
So when did you start performing this for the first time, and how many procedures have been done since that initial one?
So I've been doing SI fusion in general since 2013. We've done probably 1,600 SI fusions in this town. And when I say 1,600, I mean 1,600 patients. If you want to count per side, we've probably done over 3,200. So every patient has 2 SI joints. So I've probably done over 3,200 SI fusion per side. And the old technique, like I said, was going in from the outside in. You have to make 2 incisions to fix both sides. This technique that I got an FDA approval for, I've probably done about 250 to 300. And this is strictly, there's no one else that's doing this. Now we've started to teach other surgeons around the country. I've had emails from surgeons in Nebraska, Minnesota, Dallas, showing adoption of this technique and with good success adopting this technique.
So you were the first one to do it, but now others have started to pick up the technique?
Yes, ma'am. So we were the first to do it at Longview Regional, and then others now that they see that it's FDA approved, and now they see that the stability is comparable, if not better, than the other techniques, and the simplicity of the technique makes it available and attractive to not just spine surgeons, pain management physicians also can do this procedure because it's teachable, it's easy to teach, and it's reproducible. So yeah, so we've had a couple of requests. Next year is going to be a very busy year for us to go and teach and do a peer-to-peer, go to the OR and show other surgeons how this technique is done.
At the end of the day, it's really all about the patients, right? Creating these techniques like this that help them live a better quality of life.
That is correct. I'll tell you, there was a patient of mine. She's 35. She had 3 children. Her last child, she had something called postpartum cardiomyopathy. So her heart wasn't functioning right. So she couldn't go to sleep with anesthesia, but she had this SI joint dysfunction from multiple pregnancies, and she wanted the surgery done. So we did the surgery awake. So we also do something called awake spine surgery. So this patient had this surgery without going to sleep. We did a local anesthetic and a little bit of propofol, which is just a little push of the sleep medication. And we were able to do her SI joint without having to intubate her because she couldn't tolerate intubation. She sent me an email and she said, it was a very, very pleasant email. She said, Dr. Vincente, I'm able to feel my left leg for the first time in years. She said, on behalf of my parents, my children, and myself, I would love to thank you.
Wow, that's got to feel special when you hear things like that, right?
Very special and makes you humble.
Now, for people who think, well, maybe I have an SI joint issue, because you talked a lot about like you just don't see it on the MRI. What kind of pain will they be feeling so they know if they need to come see a spine surgeon?
Yes, so the pain for SI joint is very similar to just low back pain. The only difference is a lot of times when you have SI joint pain, patients can pinpoint that pain with a finger. Typically, it's off midline, it's just around the waistline. And most patients, if you find yourself having to sit on one side of your back, I say one side of the buttock, if you have to sit on one side because you're taking pressure off the other side because it hurts, that is the classic description of SI joint pain. If you have pain going from sitting down to standing, that is excruciating, that is classic SI joint pain. If you have pain in the back that radiates to your groin, that is classic SI joint pain. If you have pain at nighttime that wakes you up in the back that radiates to your groin or down the leg, that is SI joint pain. So now that we know what SI joint dysfunction is like, when I see them in my office, my nurse practitioner on my staff, they know that they ask the questions, where does your pain start from? And if they can pinpoint with a finger that this is where the pain is, most likely this is an SI joint pain. And what it does is it reduces the chance of having unnecessary surgery, because if you go to a surgeon that doesn't do SI joint fusion or SI joint treatment, they're never going to look for SI joint dysfunction. What they're going to look for is what they are trained to do, which is lumbar surgery. And sometimes I've had patients that had lumbar fusion that come into our clinic with severe excruciating pain, and right there I know exactly where the pain is. I know it's a SI joint pain, and once we send them for a diagnostic injection, so basically what we do is you send them for a diagnostic injection. The injection is done with a CT guided imaging. If you get up to or more than 75% improvement with the injection, then that's the diagnosis of SI joint dysfunction. And then we can proceed with stabilizing the SI joint. And now, if you don't want to have SI joint fusion, because you're scared of the word fusion, you can have another injection just to confirm that this is the problem. I always tell people that SI fusion is not back surgery. It's not back fusion. It's the SI joint is where the spine and the hips come together. So, people get nervous when they hear the fusion. This is not a spinal fusion. This is a sacroiliac joint fusion, completely separate from a spinal fusion.
Anything that we left out that you think is important for patients to know about your new procedure?
Well, I like patients to know that this is a unique procedure that is offered here in East Texas. It's a minimally invasive procedure, 25 minutes. If it's one side, it takes about 15 minutes. It's non-invasive. It helps treat patients that have normal lumbar pathology. So you get an MRI of the back, it looks normal. We don't just send you to pain management. Uh, we address the sacroiliac joint. You don't have to leave town. There are patients that come from out of town to Longview, Texas, just to have it addressed. And the fact that we have it here and we offer it to our local public is a blessing. So I want patients to, if they have any questions, they can call our office. Our number is open, is on the website, but it's 903-758-2746. That's the main number. And they can just ask to see Dr. Ogunsende for an assessment to rule out sacroiliac joint dysfunction.
All right, thank you so much, Dr. Ogunsende. I appreciate all this valuable information. It sounds like it's been life-changing for a lot of East Texans.
Thank you so much for having me, and I appreciate it.
Thank you so much.